Well, some of America's biggest health insurance hitters are spending a lot of time on Capitol Hill these days. Why? Well, because healthcare reform could hit the bosses squarely in their paychecks. Bloomberg's Zahra Burton joins me now with more.
And Margaret, the thinking is if you're about to get millions of new customers, you shouldn't get subsidized like other firms do for executive pay. And that's really behind the Senate Finance Committee version of the health care bill, really trying to limit how much these insurers can write off in executive pay from $1 million to about $500,000. Now, that could affect the cash salaries at CEOs. United Health, WellPoint, Aetna, Humana, Cigna, they pulled in an average $11 million, including bonus and stock last year. The highest paid of the lot, Aetna's Ron Williams. He made $24 million. Now, this could be part of the reason that Williams has personally met with the president 5 times. He's held more than 70 meetings with lawmakers, and he's testified before Congress about 5 times. In addition, we know that, broadly speaking, the issue of compensation came up at a recent meeting between White House officials and the top industry lobbyists. And even though CEOs, they may technically be able to make up the cash shortfall with bigger bonuses and stock grants, one of the compensation experts that we talked to says, you know what, there's probably also a lot of concern out there about what could be next.
They probably suspect that this is the first step of many that will be taken by the Congress or the administration to interfere with the operations of their company.
And Margaret, of course, based on the experience of Wall Street, could be reason for concern because remember, these same limitations on tax deductions, that's how we all first started out. They were first applied to the TARP recipients. And of course, that's one of the initial steps just leading up to last week's government big crackdown on executive pay.
So how would the public option affect pay?
Well, basically, Margaret, Goldman Sachs had put out a report just very recently talking about the bear case, and this could potentially include the public option. And what they were saying is that Humana is definitely going to take a hit. See, talking about earnings growth or earnings shrinking about 10% on an annualized basis from growth projected if nothing happened. And then also WellPoint earnings, they're expected to shrink as well. Aetna expected to take a hit, maybe 2% growth versus something like 5% plus earnings growth. So these CEOs, because of course they get compensation based on what's happening with the stock as well in terms of their options, their awards and that kind of thing. If the stock takes a hit, that could impact their compensation going forward.